Many women have it, and none of us can stand it. We're talking about cellulite, but there's a way to get rid of the unwanted dimples. Welcome Dr. Edward Bednar from Bednar Cosmetic Surgery. Dr. Bednar, thank you so much for being here.
Thank you.
What causes cellulite? I mean, it seems most women have it no matter what their weight, their size. That doesn't really seem to matter because you see thin people walking around with cellulite.
It's a genetic predisposition, and so unfortunately you can be, in the best shape of your life. You can be young, you can be old. It doesn't matter. You're going to have a component to it, and that's the frustrating thing about it. We can do something about it now.
You really can do something about it.
We can really do something about it.
I think people get skeptical. Patients get skeptical because for so many years they're like, yeah, I tried this, nothing works. You say this Cellulaize really works.
This really works. There's great stability to it. I mean, what we found in the past, all the other modalities, they really didn't work. I didn't add them to the practice for that reason. Now we have something that works. I really want the ladies to know it. And for the past year, since the FDA approval, we've been using it, and the ladies are ecstatic. They're in shorts, they're in skirts, they're in things that they've never been in their adult life.
That's exciting.
It's exciting. It's made a big difference.
How does Cellulaize work?
Well, basically, it's minimally invasive. It's just about 1 millimeter or 2 small little incision that we place the laser cannula through. And the laser cannula, we've got a good demonstration here. It's just marking, and you mark the ups and downs. You mark the hills and the valleys of cellulite, and you mark this grid here because these grids are what we're going to concentrate on treating. And see, the cannula is no larger than what you see they're pictured there. And it just goes below the skin surface, and the hills and valleys are caused by a little bit of fat in the compartment. Those fiber septi is caused by the skin's a little bit thinness to the skin. So we go in and melt a little bit of the fat to get rid of the hill, and we divide the fiber septa to get rid of that valley. And then what we'll do is we'll turn the laser on the undersurface of the skin, and we'll use it there to help thicken it up. And the most remarkable thing about this is in about 6 to 8 months we see a 30% increase in the thickness to the skin there too. So this is a modality we've never had, and I really want the ladies to know that it really works.
Very exciting.
All the things that they've spent thousands and thousands of dollars in the past on that haven't worked, we've got something that really works.
This one's different. This one really works. How then is it different from the other treatments?
Well, the other modalities weren't treating all 3 of those components that we just showed, so it didn't have the stability to it. Also, the reason men don't have cellulite is that they have an oblique kind of orientation to those fibers, and we're really converting the women's anatomy now to that oblique, and that's what that laser does. It's really remarkable.
Dr. Bednar, is there downtime from this treatment?
A day or 2 is all that's really required. Now, you do wear a garment, you wear it underneath your clothes, you wear it for about 3 weeks. There'll be a little bruising and swelling, but as I said, this is minimally invasive. You don't, there's not a general anesthetic involved with this, those things. So it's done under a tumescent technique, maybe a little twilight sleep, depends on what the patient wants.
Okay, how does it feel during the procedure? Is it
How does
it feel? Is it?
Oh, afterwards?
Yeah.
Oh, very little, if any, discomfort, as I said. It might be a little sensation of kind of like a workout, a burn of a workout.
We can handle that. We can do that. Can we see some before and after pictures? I want you to get a look at what Dr. Bednar is talking about. Well,
I say we're going to see at least 70 to 80% resolution of what you see in cellulite in the majority of patients. And what I'm so excited about is I've seen in my patient population some of them at 90 to 95% resolution in their before and afters. And that's exciting for surgeons. I've never been able to offer anything to the ladies before for cellulite. I even told them, look, there's nothing that works. Now we have something that works. So it's, as I said, it can be really remarkable changes. And it helps to tighten that skin up. When you're thickening the skin up like that, it helps to tighten it up. A lot of ladies do the areas of the anterior thighs, just above the knees, too, and find they tighten the skin up. I mean, so it's not just the modality working for cellulite itself, it's also getting a skin tightening.
Did you bring that little laser here today? Would have been nice during a commercial break.
Well, it takes me a little longer. It takes me a little longer than 10 minutes. But
how many treatments do you need? Are you one and done?
Just one treatment.
Okay.
Just one treatment is all it is. And this, as I said, the people that are out in the study are now 4 and 5 years out, and they've stayed stable.
Oh, I love this thing. All right, Dr. Bednar offers free consultations. If you are interested, again, it's a free consultation. Call him at 704-366-6700. The
website has a lot of good video on it, too.
Oh, yeah, if you go to your website.
You go to the website, and it has a lot. It has me demonstrating the procedure right there. We've got some video of me talking about it and demonstrating it.
Very good, Dr. Edward Bednar. Thank you. Again, the number was there on your screen. Thank you so much for your time today.